Dr. JMac, hello.
Good morning, Ken. How are you?
I'm doing just fine. Do I have that right, JMac? Is that correct?
It's actually Jamac, but close
Jamac.
enough.
Okay. Dr.
Yep.
William Jamac. Okay. That's it helps to know how to pronounce your name, you know? I want to get it right. Where are you, sir?
I'm sorry?
Where are you?
I am in a town called Allenwood, Pennsylvania.
And where is that in regards to Philadelphia or Pittsburgh or somewhere?
Probably in the middle of the state. We're almost dead center in the middle of the state. If you've ever heard of a city called Williamsport, we're about 10 minutes from there.
Okay, we're kind of the same way. Wenatchee is right smack in the middle between Seattle and Spokane, if you know where those are.
I do. Yep.
So that's where we're at. We're both in the center of the state. Nice to know. How is Allenwood today? Nice day?
Oh yeah. Yeah, nice day. Sunny, 40s, 50s, beautiful day.
There you go. Kind of perfect fall day.
Indeed.
Okay. Let's talk about opiate addiction and apparently a new drug that is out to help combat that, correct?
That is correct.
Tell me a little bit about opioid. What are opioids? I've never heard that term before.
Okay, opioids refer to a family of medications that are essentially affect receptors in the brain involved in pain and analgesia. So opioids are typically painkiller medications, things such as OxyContin, Vicodin, Percocet, fentanyl. Heroin is obviously also an opioid, but not used in medicine per se as a street drug, but it affects the same chemicals in the brain and body.
How many people are addicted to these? Do we know?
Yep, we do. The most recent study in 2008 lists 16 million Americans ages 12 and older who are addicted to prescription drugs or heroin. And if you include alcohol dependence and other drugs, we're talking well over 30 million people in the country are addicted to drugs. Huge problem, national crisis. Definitely need to deal with it.
Why is this happening? Why are these numbers increasing?
Well, a variety of reasons. Obviously, people have genetic predisposition towards becoming addicted. The availability of pain medications and narcotics continues to increase, as does the availability of street drugs. And I think we don't do a very good job at prevention in the country. So I think we need to work on all avenues.
Are these drugs easy to get addicted to?
They are very easy. In fact, many people are prescribed these medications for pain. They're on them for a period of time, and they become physically dependent and psychologically dependent on them, and then they become addicted. And at CRC Health Group, we're happy to be involved in treating these people and helping them reestablish normal lives. We are the country's largest drug treatment provider and are really happy to assist people when they need help.
Do people come to you or are they referred to you?
Both. We have people who are referred. We have people who directly seek treatment. And if you or a loved one or know of someone who does need treatment, they can certainly obtain treatment through our website, which is seekhelpnow.com, or call CRC Health Group at 866-575-8186. And we would be happy to provide them with the treatment opportunity.
Okay. Now, there's a new drug that's out to help people who are addicted to opioids, Vivitrol. What is Vivitrol?
Well, Ken, Vivitrol is actually, I think, a huge addition to our treatment armamentarium, and it's going to be a game changer. Vivitrol is an injection that you get once a month. So it's a medication that you take by injection once a month. And what it does is it reduces the urges and cravings to use. So typically this would be handled in such a way that a person with opioid dependence or alcohol dependence would achieve abstinence, typically in an inpatient drug and alcohol treatment center, and then after a brief period of abstinence would obtain this injection. This then prevents the urges and cravings to use opioids or alcohol and assists the person in maintaining sobriety and helps to prevent relapse.
What is it in the Vivitrol that works? Is there a certain ingredient that does the trick?
Yes, the active ingredient in it is the name of it is naltrexone. It is an opioid blocker. It blocks the opioid receptors in the brain. And it's thought to work through the reward centers in the brain to prevent urges and cravings for both opioids and alcohol. And it's made by a company called Alkermes. It was just FDA approved for opioid dependence in October, and I believe it's going to be a huge addition to our treatment armamentarium for people with opioid dependence as well as alcohol dependence. At CRC Health Group, we've been using this drug since 2006 for alcohol dependence. It's just recently been added as an FDA approval for opioid dependence.
Okay. So is this designed to be administered or taken in sort of a rehab setting, and then can it be taken outside?
Yes. Typically, the usual way that things are managed is a person would come in for treatment, be detoxed from their opioids or alcohol in an inpatient setting, which is typically safer for detoxification. And then they would, after a brief period of abstinence, receive their first injection of this medication. Then they would be given assistance in finding providers in the community who would be willing to continue to inject them on a monthly basis for a period of time to help reduce their risk of relapse. Medication is injected once per month, and it's an IM injection. It goes into the muscle typically.
Okay, so it's a shot, it's a shot, not a pill then.
Correct. And it really is different than what's out there in medication-assisted treatment. Typically, medication-assisted treatment with methadone or Suboxone, et cetera, involves taking a pill every day, and those medications are typically addictive narcotic medications that help reduce some of the risk and criminal behaviors and so forth that addicts typically engage in. Vivitrol is different. It's not addictive. It doesn't typically cause an intoxication state or it's typically not at high risk for diversion or any illegal or illicit activities. So it is really a game changer. It's different than anything we have at this point.
That's a question I was going to ask. I mean, if you're giving a drug to treat addiction, what's the likelihood of getting addicted to the drug itself? So you're saying it's non-addictive.
Correct. It's non-addictive.
That's good news. Are these designed? Can this be used for anybody? I mean, it says here we're talking about in large part youth who are getting addicted to these drugs. Does it work as well? Does it work well across the board?
The current FDA approval is for adults 18 years and older. They haven't done the safety studies and obtained the data to demonstrate that it's safe and it works well in children or teenagers.
Okay, all right. So then, what's the I guess our exit here is how do we know that somebody is ready for this? I mean, what are the factors that say, okay, now you're good for Vivitrol?
Well, I think if you talk about who is a good candidate for this, anyone who is alcoholic or opiate dependent, who has an interest in quitting and stopping their use, is a good candidate for this. There are certain, medical things that need to be assessed. People need to have, relatively good health, a functional liver, a variety of other things that need to be in place to use the medication. But for the most part, the vast majority of individuals addicted to opioids or alcohol would make good candidates for this medication.
Anybody who wants to know more, where can they go?
They can certainly contact us through our website, which is seekhelpnow.com, or call us on our phone. CRC Health Group's phone number is 866-575-8186. Vivitrol is made by a company called Alkermes, and I'm sure that one could visit their website and obtain useful information about the drug as well.
how do we stem the tide of addiction? How can we, help people avoid getting addicted in the first place?
This has been a huge topic of discussion throughout the country, and I think there's no easy answer to that. What it really boils down to is starting young, communication over dinner, lunch, speaking with your children, knowing who they're associating with, where they're going, knowing what's going on in their lives, being able to communicate and understand, being vigilant. However, as many of us know, addiction does not just affect youngsters, teenagers, adolescents. It also affects adults. There are many people who have had great childhoods who somehow managed to become addicted or dependent on these drugs. And I think, that education needs to be in place for adults as well as physicians and and healthcare providers who use narcotic medications sometimes more so than they need to, and make them more readily available for people.
Dr. William Jamek, time is gone. I know I got to let you go, but I thank you for taking some time out, and good luck with this.
My pleasure. Thanks for having me, Ken.
All right. Take care in Allenwood.
You too. Take care.